Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. But before we get started, happy Nurse Practitioner Week, you guys. I just wanted to take a moment as we are kicking off Nurse Practitioner Week to first say happy NP Week to our current nurse practitioners, my colleagues, my friends, family, all of us in the profession. I want to say thank you for all that you do. I know that all that it entails in this role, and it is a gift as well as a privilege to be able to have this impact and be able to shine our lights in different ways. So thank you. And I appreciate you and I value what you bring to the profession. Thank you, thank you, thank you for all that you do. Also, I want to say congratulations and happy MP week to all of my reviewers who have passed boards this year. This is your official first nurse practitioner week. I know it's exciting and I hope you have an amazing week. Go out there, shine your light, and I would love to hear all the updates on what you're doing currently on your nurse practitioner journey. Now, y'all know I always like to celebrate with you guys no matter what. So make sure that you are tuned in because we will be doing giveaways and different fun things all throughout the week. But to kick us off, I want to be able to give back in to show appreciation and to celebrate where you are and where you're going, right? So for my MP reviewers, I am offering a free ebook for whoever is selected from today, right? And so the way to be entered into the drawing, you must like this video and comment under this video to be entered, okay? To get a additional entry, tag a friend who may benefit from this as well. So again, if you like and comment under this video, your name will automatically be entered into the drawing for a free review book in the ebook option for family and adult Gero reviewers to help you study and prepare for boards. And if you tag someone into the comments also, this will also give you an additional entry, okay? The more people you tag, the more entries you get. Also, for my current nurse practitioners, if you do the same, like and comment, you will be entered into the drawing for a 25% off of a scrub set of your choice. And once the drawing is complete, I will give you all information for that. Okay. All right, you guys. Again, happy Nurse Practitioner Week, and thank you for all you do. And for all of the students who are preparing for their MP journey, y'all, happy Nurse Practitioner Week to y'all, too. Continue to push, 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 as you will be right here with us very soon. All right, question number 1. A 32-year-old patient presents with symptoms of acute sinusitis, including facial pain, nasal congestion, and purulent nasal discharge for the past 10 days. He states that he has tried over-the-counter decongestants and nasal sprays without any relief. The patient has no significant medical history and is not allergic to any medications. Which of the following is the most appropriate first-line treatment for this patient? Is it A, oral amoxicillin and clavulanate? B, continue oral decongestants and nasal saline irrigation. C, start nasal corticosteroids. Or D, oral azithromycin. Take a moment and tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. Here, the stem of the question states, which of the following is the most appropriate first-line treatment for this patient? Now, y'all know I always say, if they're asking you for a treatment, you need to run it back and see if they have provided you with a diagnosis, discharge, with a diagnosis. And in the event that they have not provided you with a diagnosis, you need to run it back a step further and look at those assessment findings so that you can determine the diagnosis. In this question, they have provided the diagnosis of acute sinusitis, letting us know that this has been going on for 10 days. He has tried over the counter decongestants and nasal sprays and still no relief. So we know that we need to do more. Also, it's letting us know that we're looking for that first line therapy option. First line treatment for cases like this for acute sinusitis, we know is augmentin, right? So A is your best answer, remembering that oral amoxicillin plus clavulanate is is augmentin, right? So make sure that you know all aspects of how the medication may be presented to you so that you don't miss it based on things like this, okay? All right, question number 2. A 65-year-old male presents with a 3-day history of fever, chills, productive cough with rust-colored sputum, and pleuritic chest pain. On examination, he has a temperature of 102 degrees, respiratory rate of 22, and crackles in the right lower lung field. Chest x-ray shows a right lower lobe infiltrate. Based on his clinical presentation, which of the following is the most appropriate first-line treatment for community-acquired pneumonia in an otherwise healthy adult? Select the best two. All right. Is it A, high dose amoxicillin, B, clarithromycin, C, levofloxacin, or D, azithromycin? Take a moment and tell me what you got, y'all. All right, here the stem of the question states, based on his clinical presentation, which of the following is the most appropriate first-line treatment for community-acquired pneumonia in an otherwise healthy adult? Select the best two. This right here tells you everything. Even though the scenario gives you all the fluff and the build up to let you know that this patient has presented, and they most definitely have community acquired pneumonia. The stem tells you everything. All we're looking for is the most appropriate first line treatment for somebody who's been diagnosed with CAP and is otherwise healthy. And they want you to select the best two. So your best answer choices are A and D. Remembering that you can utilize high dose amoxicillin as well as azithromycin as first line therapy for community acquired pneumonia. Remember that it goes in tiers. Monotherapy, you just need one, either that macrolide of your azithromycin or the high dose amoxicillin. When you need dual therapy, maybe they have more of a history, they may have more risk factors, and they're warranting more coverage. You would do dual therapy, so you would give the azithromycin plus the high dose amoxicillin. And for those people with, like DRSP, and they are in critical situations, we pull out the big guns and we give those respiratory fluoroquinolones like your levofloxacin. And remember the Britney's brilliance of Get My Lungs, GML, G for Get, G for gemafloxacin, M for My, M for moxifloxacin, L for lungs, L for levofloxacin as your respiratory fluoroquinolones, because we're trying to get our lungs together, right? So just remember and pay attention to how the layout is when you're approaching treating community acquired pneumonia, so that you know whether you're doing monotherapy, dual therapy, or pulling out the big guns. Okay. All right. Question number 3. A 58-year-old male with hypertension presents for follow-up. His blood pressure is 152/94. He has no significant comorbidities, and his lifestyle includes regular exercise and a low sodium diet. And based on current guidelines, which of the following is the most appropriate first-line treatment for this patient? Is it A, initiate a thiazide diuretic, B, start a beta blocker, C, initiate an ACE inhibitor, or D, start an ARB? Take a moment to tell me what you got. So, similar question here states, based on current guidelines, which of the following is the most appropriate first-line treatment for this patient? All right, so again, we're looking for treatment. Let's see what it's telling us. So the diagnosis is hypertension. This patient came in for follow-up. Blood pressure is still elevated. It's 152/94. He does not have any significant comorbidities. And he does the appropriate lifestyle modifications with regular exercise, the DASH diet, doing all the appropriate things. So we know we need to treat this patient, because remember, with ACC and AHA guidelines, which is what they are currently testing on boards, that we treat based upon several factors. So if this patient does not have comorbidities, meaning they are considered healthy, when we're just looking at a medical history perspective, if they do not have any comorbidities, then if they exceed a blood pressure of 140/90, the guidelines state to go ahead and initiate therapy, right? Medication therapy. So here he's clearly over that 140/90. And so we know we need to initiate medication therapy. Next, I always tell y'all, think of the 4 first-line therapy options being your thiazides, your calcium channel blockers, your ACEs, your ARBs. And that I always say thiazides are the captain, right? Because they are the first line therapy. The only time you don't go first with the thiazides is if there is some type of allergy or some type of medical history that warrants the benefit of some other medication, right? That are in that for starting lineup. Meaning, like if they have a history of diabetes or things that require renal protection, you want to go with the ACE or ARB first, right? If they are African American, we can do thiazides or calcium channel blockers. So if you're unable to get the thiazide first, for say like they have a sulfa allergy or something, then you would go with your calcium channel blockers. But for testing purposes, you know that thiazides are the captain of the first line therapy. So unless there's a reason that you need to rule out using the thiazides, you go with a thiazide. So in this situation, thiazide is the answer. There's nothing that says that they can't have it, like a sulfa allergy, major electrolyte issues. They don't have gout. Give the thiazide, okay? All right, you guys, I hope you found this helpful. All week, I'll be doing things like this. I'm doing random questions so that we hit each system this week so that we are gauging some of those common diagnoses in a test format all week long. So this week, you see, so far I did EENT, respiratory, and cardiology. So tomorrow we'll do 3 more systems just to gauge some of those common symptoms, diagnoses, so that you can apply your knowledge. Because as we're on our MP week celebration, let's continue to build our nurse practitioners in the making. But y'all, be sure to like, comment, subscribe. Make sure you have your notifications on so you don't miss any of the deals. Also, those of you who are subscribed and on my email list or following on my other channels, know that y'all will have early access to the upcoming things, as well as those of you who are a part of my membership program on YouTube. Y'all will get early access to the Black Friday deal, so y'all be on the lookout. And if you do need anything that I do offer, y'all know, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you're looking to review independently, I have my self-paced review course for family and adult Gero, also linked in the bio of this channel. If you need to do any practice questions, all of my QBank options are linked in the bio of this channel. And as always, if you're looking to book any one-on-one sessions with me, be sure to call, text, or email, as I offer a variety of one-on-one session types. And I like to speak with you first to gauge what you truly need to make sure you're booking the appropriate session. All right, you guys, as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.